Hello everyone! Typhoid fever is a common infectious disease that occurs most commonly in children and young adults. It's caused by a bacterium called Salmonella typhi, which is a type of bacteria that lives in the intestines of humans and some animals. It's spread through the feces of an infected person or animal and can contaminate food and water. It can also be spread through close contact with an infected person, such as through the air or by sharing utensils. In this video, we will discuss the symptoms, prevention, and treatment of typhoid fever. So make sure to watch the video till the end. And if you are new here, please subscribe for future updates. Typhoid fever is a life-threatening condition that can cause high fever, weakness, headache, diarrhea, and abdominal pain. If left untreated, it can lead to complications such as intestinal bleeding, perforation, and death. However, with prompt diagnosis and treatment, the outlook for people with typhoid fever is generally good. Now let's talk about the symptoms of typhoid fever. The symptoms of typhoid fever may appear suddenly and include a high fever, weakness, headache, dizziness, abdominal pain, constipation or diarrhea, rose spots, which are small pink spots that may appear on the chest and stomach, and an enlarged spleen. Some people may also experience confusion or delirium, especially during the first week of illness. These symptoms may come and go for 2 to 3 weeks before they disappear completely. The incubation period for typhoid fever is typically 1 to 3 weeks, but it can be longer in some cases. The disease progresses through 3 stages. The first stage is the high fever stage, which can last for up to 2 weeks. During this stage, the person will experience a high fever, headache, weakness, and abdominal pain. The second stage is the secondary stage, which usually starts after the first week of illness. During this stage, the person may develop rose spots, a rash of small pink spots that appear on the chest and stomach. The third stage is the recovery stage, which can last for several weeks. During this stage, the symptoms start to improve and the fever goes away. However, some people may experience complications such as intestinal bleeding or perforation. Now let's move towards the prevention of typhoid fever. The best way to prevent typhoid fever is to practice good hygiene, such as washing your hands thoroughly with soap and water, especially before eating or preparing food, after using the toilet, and after changing diapers. Avoid close contact with people who have typhoid fever. This includes kissing, hugging, and sharing utensils. Cook food thoroughly, especially meat and eggs. Avoid raw or undercooked shellfish. Drink safe water. This means either boiling it, using a water filter, or using bottled water. If you travel to areas where typhoid fever is common, take precautions to avoid getting sick. This includes getting vaccinated, practicing good hygiene, and being aware of the symptoms of typhoid fever. Now let's talk about the treatment of typhoid fever. The standard treatment for typhoid fever is a course of antibiotics. The length of treatment will depend on the severity of the infection and the response to treatment. In some cases, the person may need to be hospitalized for intravenous antibiotic therapy. In addition to antibiotics, the person should also get plenty of rest and fluids. It is important to complete the full course of antibiotics, even if the person starts to feel better before the medication is finished. This will help prevent the development of antibiotic resistance. There are several different antibiotics that can be used to treat typhoid fever, including ciprofloxacin, levofloxacin, azithromycin, and ceftriaxone. The choice of antibiotic will depend on the severity of the infection and the local resistance patterns. If you have any concerns about typhoid fever, please talk to your doctor. Your doctor will be able to assess your individual risk factors and advise you on the appropriate course of action. You should seek medical attention immediately if you experience any of the following symptoms: a high fever that does not come down with medication, severe headache, confusion or delirium, abdominal pain, constipation or diarrhea, or a rash. Thank you for watching this video. Please share this video with your family and friends so that they, too, can learn about typhoid fever. And don't forget to subscribe for more health videos like this. Stay healthy.